I please have your attention? If you wouldn't mind taking your seats, we're just about to begin. Thank you so much, and hello to everyone online. Friends, a very warm welcome to the launch of Safer Shared Air. I'd like to formally begin this session by acknowledging the traditional owners of the lands we're meeting on, the Ngunnawal people, and celebrating the fact that Australia's First Nations people were the world's original carers for country and carers for community. And that's what we're going to be talking about today. For those of you who don't know me, my name is Tracy Spicer. I've been a journalist since roughly the early Cro-Magnon era, and I became very passionate about this subject in 2022, when I caught the Delta variant of COVID-19 and a couple of months later developed long COVID. That's really put me on a lifelong journey of understanding about people who live with who are immunocompromised or live with chronic conditions, invisible illnesses or dynamic disabilities, all of which I identify with at the moment. And really, when you think about it, this is a human rights issue. This is about people's freedom, children's freedom to go to school in safety and breathe clean air, workers' rights to be able to go into a workplace, the simple freedom and joy to be able to do what we want, to catch up with our friends indoors without ending up with a life-threatening illness. The other reason I'm so passionate about this is because of this wonderful woman on my right. Our first speaker has worked in health policy and public affairs and patient advocacy for the past 20 years. As a result of her professional background and personal lived experience with an immunocompromised and high-risk family, she's founded the Safer Air Project with a vision to create a world where everyone can breathe safely indoors. It is simply a human right. Please welcome Plum Stone.
Good morning, everyone, and thank you all so very much for being here. And thank you, Tracy, for the introduction. I feel very old when we say 20 years. Before I begin, I would also like to acknowledge the Ngunnawal and Ngambri people as the traditional owners of the land on which we gather today, and pay my respect to elders past, present and emerging. We will shortly welcome Assistant Minister Jed Carney, who has been called to a division and will be joining us shortly. So I'll skip over the bits where I talk about how wonderful she is and say those later. Before Assistant Minister Carney kindly launches our report, I would like to share a little bit about why we founded the Safer Air Project and why we're here today. As Tracy said, at the start of the pandemic, I was living in the UK with my young family. Before we went into lockdown, we all became sick, and I lost my sense of taste and smell for 2 weeks. 10 days after our symptoms began, my 3.5-year-old daughter suffered a prolonged status epilepticus seizure and was hospitalised. It was 45 minutes before they gave her the buckle that stopped the seizure, and it was several hours before she woke up. They truly were the longest hours of my life. She continued to be very unwell for many weeks and was hospitalised 3 more times over the course of the next 2 weeks. Within months, I began developing neurological and cardiovascular symptoms that we now know to be symptoms of long COVID, and which sadly persist today, which is why my heart is racing. Both my daughter and I had no known risk factors for poor health outcomes. We were previously healthy, and yet we still suffered poor health outcomes from that initial infection, just like Tracy. Adding to our family risk, my husband has an autoimmune disease and is severely immunocompromised. He needs to have a transplant, and so remains at significantly increased risk of poor health outcomes from any infection. Unfortunately, the increased risk of transmission of airborne pathogens is an ongoing problem that disproportionately affects people like us because of these increased risk of poor health outcomes from exposure to infections, but also other airborne pollutants. Thank you, Assistant Minister.
I'm trying to sneak in unnoticed.
I'm going to go back to the bit where I'm saying I'm extremely grateful to you for being here, so thank you very much. Over the past few years, as a result of our experience in my almost 20-year history working in healthcare policy, I have spent the last few years exploring the solutions to create safer and more inclusive environments for families like mine, because we are not alone in our experience. People living with high-risk conditions like cancer, diabetes, cystic fibrosis, kidney disease, cardiovascular disease, asthma, and many more are not rare, and we are not isolated. We're in every room, in every workplace, in every school, and we should all be able to breathe without risk of harm. Over the last few years, it's become clear to me that we face an accessibility and inclusion issue as a result of poor indoor air quality that increases our risk of exposure to airborne pathogens and other pollutants. Solving this problem could therefore be addressed by applying the same policy frameworks that already exist to ensure the presence of other accessibility features. In other words, it's time to recognise improving indoor air quality as an accessibility feature and make our shared air safer for everyone to breathe, because the burden of responsibility for staying safe shouldn't rest with the high-risk and immunocompromised person, especially when that person is a child and we all share the same air. That's why I founded the Safer Air Project and why we're here today. So thank you all for being here. Thank you, Assistant Minister. Thank you, Dr. Ananda-Raja, for being here. Thank you both for your ongoing commitment to clean indoor air. It means a huge amount to Amy and I, so thank you very much. I'll hand back over to Tracy to introduce our special guests.
Thanks.
Plum, I'm so deeply sorry for what your family has gone through, but thank you for, using that in your powerful and transformative work to help others. That's a really generous act. You are a phenomenal person and an incredible advocate. I'd also like to thank everyone in the room here today who's come along, especially those who are immunocompromised, because we understand that you come and it is a risk. So that's very generous of you to do that as well. Our next speaker is the Federal Member for Cooper, Assistant Minister for Health and Aged Care and Assistant Minister for Indigenous Health. Her working life, really from being a nurse to President of the ACTU to being a parliamentarian, has all been about fighting for the rights of others, particularly the vulnerable. She's a strong voice for social justice, workers' rights, universal health care and now indoor air quality. Give it up, yes, I'm a fangirl, for Jen Carney.
Thank you so much for having me, and thank you for that lovely introduction. But you are the real heroes, all of you here today, in this journey that we've been on. But I'd start by acknowledging the traditional owners of the land on which we're gathered, the Ngunnawal and Ngambri peoples, and I pay my respects to elders past and present, and to all First Nations people with us today. It's such an honour to sit here next to you, Plum. We've been on a journey and you've been there from the very beginning. In fact, I think you might have been one of the first people to really open my eyes to this issue, and you've done it all through the lens of people who are particularly vulnerable. So thank you. You've been amazing, and you've set us on the right path. There's lots of wonderful people in this room who have helped, not the least of which is my good friend, but I'll come to her shortly. I want to acknowledge everybody that's here today who has really helped Michelle and myself and other people in this House push this incredibly important agenda. I can just see so many faces. If I start naming people, I will forget someone. But I particularly want to acknowledge the work of my colleague here on my right, the member for Higgins, Dr. Michelle Ananda-Raja. Amazing, Michelle. A medical specialist before entering Parliament, and during the pandemic she co-founded Healthcare Workers Australia to advocate for improved respiratory protection for frontline healthcare workers. Now, since her election, my goodness, Michelle has been instrumental in driving efforts within this government to prioritise indoor air quality. The hours, and she sat in my office, and the phone calls, bit of plotting, bit of scheming, bit of this, bit of that, but just walking these halls, as you have, all of you have walked the halls of this place to make some really important change. Michelle, it's an absolute travesty that your seat has been disappeared by the Electoral Commission. But we hope to find a way to keep you in this House to continue that important work. If I say any more, I'll have to shoot you all. So. But I am really excited today that we are launching the Safer Air Project report.
It's on its way.
It's on its way?
It's on its way.
From?
The loading dock.
Oh, the loading dock.
Yep.
I know about the loading dock. It's a place where a lot of good reports go to die sometimes. You don't get them out of there.
Your office are doing their best.
Are they?
Yes.
Fantastic. But once the report comes, it is safer shared air, a critical accessibility and inclusion issue. In Australia, we have to say we do, for the best part, enjoy good air quality. We are very lucky. But events in recent years, like bushfires and COVID-19, have shown that we are vulnerable and we need to be prepared. And that's why in July, after a lot of consultation with so many people here, Michelle and I asked the National, or last year, July last year, asked the National Science and Technology Council to commission a report on indoor air quality. And this was done with the blessings, I might say, of Minister Husick, who is responsible for that council. And he's been very supportive and has brought actually a really great perspective to all of this. We released that separate report and the Council's advice in August this year, and that report is being considered now by nHealth, which is one of the committees under the Australian Health Protection Committee. And it's a very important piece of advice, and the work that nHealth is doing is also important. The Safer Air Project's vision is to create a world where everyone can breathe indoor safely. The report advocates for safer indoor air quality as a critical accessibility and inclusion issue for people living with chronic health conditions. And this is bringing a whole new impetus to the whole issue that we have been grappling with over the last couple of years in this place, a really incredibly important perspective. I know you'll all find the report interesting. I can't wait till it makes its way up here from the dock. It finds that there is an inaccurate perception that people with chronic illnesses are a minority in Australia. And the reality is, and according to the ABS, that 1 in 2 people have at least one chronic health condition, with those more likely to be affected women, we know, which is quite interesting from my perspective. I have a very strong interest in women's health, and older Australians. So chronic health conditions are, of course, an economic issue, with 1 in 3 people living in areas of most disadvantage having 2 or more chronic health conditions, compared to 1 in 8 of those living in areas of least disadvantage. Extraordinary statistics. Postcodes do matter in this country, which is extraordinary. For many Australians with chronic health conditions, this report has found a lack of recognition that poor indoor air quality is reducing their accessibility. The report calls for us to expand our thinking on accessibility, and it's really a really important call. We need to always consider people with chronic health conditions. Hurrah! It's here. And it highlights that even people without known risk factors are actually at risk. So obviously we all know, and everyone in this room knows and believes, that air quality in indoor spaces matters. And the report finds, however, it puts particular emphasis on particular spaces that they say, the report says, are critical: education, healthcare, disability, aged care and residential care settings. And the report also finds that workplaces and businesses also need to be invested in improved indoor air quality. One of the big things that brought me to this critical issue and wanting to work closely with Michelle and I discussed the effect on workers and how workers are exposed to risks that are unacceptable. And so not only healthcare workers, but people who work in schools, people who work in aged care settings. So the report is very important. As I said, it's brought a whole new aspect to this debate, which was always there, but it's now we have this critical piece of information and data that will help us argue that. and it will definitely play a very large part in our considerations. We'll be passing it on to the in-health for sure to consider it in what they are working on right now. So congratulations. Thank you so much for this critically important work. I can't tell you how wonderful it has been to have you every step of the way through this journey, Plum. And I didn't know your name was Victoria. How about that? I just learned that. And this is an incredibly vital step towards everybody having safer indoor air quality for everyone, for all Australians. So I commend you highly for the report. I'm very honoured to be here with my good friend Michelle to help launch it, and congratulations.
Thank you.
Thank you, Jed Carney, for your invaluable support and also for framing it as an accessibility and inclusion issue, particularly through the lens of women's rights. Yes. Because we know that, and we've got the CEO of Emerge Australia here, the wonderful Anne Wilson. You know, we know so many people like myself end up with ME/CFS and POTS as a result of a post-viral illness, and overwhelmingly this impacts women. So thank you very much. I'd also like to acknowledge the incredible Zoe Daniel, who's joined us in the room. Thank you for your extraordinary work, particularly around vulnerable communities and people in marginalised communities. Next, we'll be hearing from the federal member for Higgins. This speaker is an award-winning researcher and medical specialist in infectious diseases and general medicine. She co-founded Healthcare Workers Australia, a grassroots advocacy group leading the fight for a better pandemic response, and she's championed the need for clean indoor air to keep Australians safe and productive. Please welcome Dr. Michelle Ananda-Raja.
Thank you, Tracy, and a profound thanks to Plum for pulling this together, the Safer Air Project. And I want to acknowledge Bronwyn for all her advocacy, the Australian Academy of Sciences. They have been the best friends of clean air and this movement. And to all of you for coming today, it is incredibly important that we see who you are, that policymakers hear from you and validate your concerns and your stories. And I know it's not easy for you to make it into a place like this. It would have been a lot of travelling and organisation in your lives, and you all have busy lives. And I want to thank you profoundly for that. And Tracy and Jed are both right. My pathway into politics was through campaigning as a civilian, as a healthcare worker on the front line during this pandemic for cleaner air. And I didn't think there was anything controversial about it at the time. Turns out it was profoundly controversial. But I saw very much, as I worked as an ID physician, infectious diseases physician and general medicine physician at one of the major hospitals in Melbourne, the effects of the pandemic firsthand. And I also saw it on the health workforce. We had trailing problems with illness and workforce shortages, which are still there, actually. This is the long shadow of the pandemic that we are still living in. And like you, Tracy, I have a friend. She's an extremely high-level medical doctor, a professor of medicine, who developed POTS and essentially had to pretty much leave the profession. And she's a little bit younger than me. So you can see how illness can cut people short at the peak of their lives. And Plum, you have a story of immunocompromise, a family who is immunocompromised. The infectious diseases I did was actually focused on caring for patients who were immunocompromised, people with all kinds of cancers, both blood cancers as well as solid organ cancers and transplants at the hospital I worked at. So I knew full well what it was like for these patients. They essentially went into hiding during the pandemic, and some of them have not emerged. Yeah. So this really is a barrier to inclusion and to participation and to living free and full lives. And I also want to say that I mentioned this in my valedictory this week. You should watch it. There's absolutely a shout out to the community advocacy group, i.e. all of you, in my valedictory. That is how important this is for me personally and for our country. I think I did tell all my colleagues that This is not my pet project anymore. Unfortunately, the seat has been abolished, but I'm so pleased to see a community advocacy group kind of rise from the ashes of this in the aftermath of this pandemic, because that is exactly what we need. We have scientists, we have experts, we have policymakers like the amazing Jed Carney, who with me has championed this, but we will absolutely need community voices to make sure leaders are held to account and that we deliver this over in a pragmatic way. I can't say tomorrow, but over a period of time. But we want to get this done. We absolutely want to see this happen. I've mentioned the productivity gains. I think that we've talked about inclusion, but productivity is on everyone's lips right now. We've just emerged from a decade of the lowest productivity in 60 years. Everyone is looking for how we make our country more productive. And sick people, frankly, are just not productive. So this is low-hanging fruit. I just also want to acknowledge the work of the Chief Scientist in pulling this scientific synthesis together, an evidence synthesis, which was presented to the National Science and Technology Council, and Jed and I both presented to them, and they were very receptive to the work. And I also want to thank Bill Shorten, Minister Bill Shorten, who a long time ago invited me to present to the Ministerial Roundtable of Ministers of Disability and the greater cohort. So the NDIS were there, NDIA, it was absolutely massive. So they are absolutely on board. They understand the importance of this to the community. How we now move forward is going to be the next steps. We know why we need to do it. We have the evidence there. We have all your stories and your faces and your voices, and they matter, both children and adults, right? The next steps are really going to be how we do this. And as someone who's a departing member, it kind of makes me emotional saying that. We really need you to help us work out how we best implement this, what is in this document now. Because this is how we will keep our nation safe, healthy, productive, resilient going into the future, because it will not be our last pandemic, nor fires or any other kind of shocks that hit our country. So thank you very much, and good luck with all of it. Thank you.
Michelle Ananda-Raja, thank you so much for your early work and advocacy on this. It's been absolutely game-changing. Yeah. And also for making that link with worker shortages and productivity. We really appreciate both you and Jed Carney joining us today. Thank you so much. So many of you in the room and those of you joining us at home either live with a chronic illness or have a loved one who lives with a chronic illness. So now we're going to have a lived experience panel to talk about the diversity of experiences and how we do live with this, how it affects our daily lives. Right next to me is the wonderful Associate Professor Robin Schofield. She is an atmospheric chemist extraordinary at the University of Melbourne, who's been working on protecting our air since her PhD, starting with stratospheric ozone chemistry. Clean indoor air is just her most recent challenge, made even more important through her breast cancer treatment last year. Thanks for joining us, Robin. We also have, on the other end here, Dr. Philip Lewis. Now, he's a biomedical engineer, neuroscientist and medtech commercialisation professional who's worked in healthcare, industry and academia. Phil's working to translate university innovations into commercialised technologies that deliver positive health impacts for people globally. He has cystic fibrosis, for which he underwent a double lung transplant. And finally, in the middle, Dr. Hayley Teasdale. She's a neuroscientist and entrepreneur who works at the Science Policy Interface, finding novel ways of providing science advice to inform decision-making. Hayley lives with a primary immune deficiency and is a board member for the Immune Deficiencies Foundation of Australia and Deputy Chair of the Patient Advisory Panel. Please put your hands together. Robin, you've been studying the atmosphere for many years now, but what sparked your interest in indoor air in particular?
Well, I think it was certainly, I have credit many people in the room here, so we've got Rebecca Bentley and Jason Monti, colleagues of mine, and I don't want to say I was dragged indoors, but I sort of was. So Jason and Forbes McGain coming up with the hood and wanting to measure its efficiency at removing infectious aerosol, working with other colleagues, respiratory physicians for a long time about outdoor air where we have standards and we can see those exceedances through traffic or, diesel, bushfire, smoke, dust in an occupational sense as well. All of those aspects coming together and then when we're sitting at home and needing to help in a way and began the conversation with colleagues. I can measure things in the atmosphere. So I was like, I could be helpful here, but they're like, can you measure aerosol? I was like, you can measure aerosol, but your question really is infectious aerosol. And then there was just one instrument that could do that, and we got that delivered within the lockdowns in Melbourne to my lounge room, and then I was like, ooh, it's a big instrument. and that was really the beginning of my journey indoors. And having lots of sensors in my house, I was like, it's time I moved away from combustion sources in my house, and had a really close look indoors when it was harder to be out in the field.
It is extraordinary, to think about the fact, I've got my little Aranet air monitor here, that we've only been really using these, I suppose, in a mainstream way in the last couple of years, measuring aspects of indoor air quality. When you started going through your breast cancer treatment, you then had a different perspective in clinical settings. Can you tell us what that was like?
I can, yes. So I'm reflecting it's probably about 18 months since I first sat in this room, in this chair, and told everyone that I've, had some bad medical news. And so nice to be back and through that journey, because it's hard for me to walk into an indoor space and not go, this is quite bad or this is quite good. So when I'm sitting in a very confined space, across from, an expert who's literally going to save my life, from the cancer, that is. And then to go, you're not masked. This is a really stuffy room. You're seeing, 20 different vulnerable patients and families at this time. And if I caught something, it would be really detrimental to my health. So that was the challenge, to go, you're an expert, you're leading in this field, yet you're not protecting me.
It is gobsmacking, isn't it? It still makes my head spin. Hayley, I'm sure you've had some experiences like that. You live with primary immunodeficiency. Can you tell us what that is and how it affects your life?
Of course. So primary immune deficiency basically means there's parts of my immune system that I don't make, and that some I do make and they don't work very well. One of the ways of diagnosing that is by doing what they call a vaccine challenge, so giving people vaccines, and people with primary immune deficiency tend to respond quite poorly to those. So as you can imagine, we don't produce much of an immune response when we're exposed to diseases, which also makes us quite susceptible to severe infections, particularly of the respiratory and gastrointestinal systems. So by the time that I was diagnosed and started treatment, I started getting sick at about 15, began treatment at 24. I already have scarring of my lungs and other effects that will carry with me throughout life.
And how does it affect your day-to-day life in order to be able to socialise, to work, to get to medical appointments?
It's a constant weight on my mind. I have a 2-year-old toddler now who goes to daycare. Now that is a whole nother kettle of fish, but I am very lucky that I have a very welcoming workplace, but I represent a lot of patients through the Immune Deficiencies Foundation who have a lot of challenges with their workplaces, and I'm one of the only patients I know who's able to work full-time because of the burden that they carry with constant infections and the ongoing impacts that they have on their bodies, as well as impacting their hobbies. I think a lot of immune deficient patients don't feel comfortable travelling, particularly in the last few years, going to shared spaces, shopping centres, movie theatres. It's just not a comfortable place to be for a lot of our patients with immune deficiency.
And it shouldn't be, but it is a difficult conversation, isn't it, to have with people, even simple things like, could you please open a door? Could you open a window? Is it frustrating?
It is, and we're almost starting to feel like we were before the pandemic, where we often wear masks in shared spaces, particularly healthcare settings, and people often think that you're the infected one, when really I'm protecting myself from infection. So you do become a bit of an icon when you start doing things like opening windows and putting on masks when no one else is.
Yeah. Phil, you've worked around, really high-end, high-tech medical devices your whole life. How did it feel when the pandemic hit and you realised that suddenly you're at increased risk to your health and there really wasn't any technology at the time that could help fix that?
Yeah, look, I mean, as a medical technology professional, I couldn't help but nerd out a little bit on the kind of government and industry response to the problem. And I'm thinking about, suddenly making lots and lots of ventilators to sort of help manage the health problem that was occurring. But at the same time, as a double lung transplant recipient, my interests were very much, and my focus was on never needing to use one, never ending up on one, because very quickly after the pandemic started, my doctors started communicating with me and the rest of the sort of lung transplant community about the really serious risk that we were facing, and that COVID wasn't just a risk to our health, it was a risk to our lives. So, that was pretty scary, and we had to work very hard, and we did work very hard to avoid catching it. But that got increasingly difficult, of course. And so, the vaccines and antivirals were really a lifesaver, and we could have the confidence that they would stop people like me from getting really sick or dying. But, I'm interested in a little more than that. I'm not trying to not get sick. I'm trying to stay well, and so for me, that's what this kind of indoor air thing is all about. It's about staying well, and I think of it as preventive medicine, and so it's a big challenge, but it's an important one. Yeah.
I love that you think about it as preventative medicine, because it really is, and there are some easy things that people can do. How do you cope psychologically when you're out in a social environment and people don't put those simple protections into place? That can be a matter of life and death for you. Yeah,
look, the little Aranet CO2 monitor, I've got one of my own here as well. It's been really quite a powerful tool, and I can tell you about a social setting I went to where I was at a friend's house. We were having a function, and I took the CO2 monitor with me. And, I sort of had to overcome the initial awkwardness and questioning about why I brought it there, and I gave some explanations. And a really fascinating thing happened. When other people at the table started to see the CO2 climb, they got up and opened the door. They got up and opened the window. When they saw what was going on, they suddenly realised, the air in the room is not so fresh anymore. And what it, I think, demonstrated to me was that most people they kind of appreciate breathing fresh air, and if they've got some objective tool to show them that the air in the room is not so fresh, they're motivated to do something about it. So I think there's an awareness issue there.
You are such a glass half full kind of guy. I really like that. Hayley, what does the Safer Air Project and this report mean to you?
It's honestly, it's just really nice to know that the immune deficiency community is not alone, because it sometimes feels like we talk about it with each other, but to be here with other people experiencing the same thing, to know that we're not a minority, as the report says, that it's almost half of Australians that live with these chronic conditions, and it's just really beautiful to see that advocacy for an issue that affects so many of us and threatens our livelihoods and our lives.
Robin, are you optimistic about a future, a near future, in which we can all breathe clean indoor air?
I am, because coming from the ozone world and working in climate as well, I do have reasons to be optimistic in this space. Like, when we come together as humans, we can solve these problems. And, the science is pretty clear. for so many different levels. Productivity, we heard about, test scores, if you're interested in those, which most people usually are, and educators for sure are. They're all elevated. So we're also facing, the climate challenges, and with that, with bushfires outside, those all influence our indoors. And so as part of our resilience to what's coming there, we really need our indoor air to be our safe haven. And so I am optimistic that we can solve this holistically and move forward.
Beautifully put. Phil, what's one message you'd like to leave everyone here with today?
I think just that, while my personal reason for caring about this issue may be quite unique, the fact that I need to care is not. This is not a fringe issue. It affects a lot of people, and it deserves serious attention.
Hayley?
I think it would just be simply similar to what Robin said, is that, we should and can do more research in this area, and it's important that we do, but we know enough to act now.
That we have the knowledge, we have the education, and now we have to act. And Robin, I'll leave the final word to you.
I really think this is about making the invisible visible. It's, if we know, and we shouldn't have to think about it, it just should be happening, and we can all enjoy fresh, clean air.
What a perfect spot to wind up on. Please thank our phenomenal panel. Oh, wonderful. We now have a live video presentation that we're tremendously excited about, and I would like to thank everyone joining us online as well. We really appreciate you being here with us virtually. Lydia Moravska is Distinguished Professor at the Queensland University of Technology in Brisbane and Director of the International Laboratory for Air Quality and Health, a collaborating centre of the World Health Organisation. Thank you so much for joining us, Lydia.
Hello, I'm joining live. It's not a video. Can you hear me?
Yes, we can.
I thought that it's much more meaningful if I'm in a way in person there, and apologies that I'm not in person there, but occasionally I have to be in Brisbane. So many thanks for inviting me, and I feel really privileged to be part of this important event. Well, science was mentioned many times during this afternoon. I'm a scientist, so for the next few minutes I could talk about this science. I could give you a summary of the science we did. And when I say we, Australian scientists and many of them. For me, this journey specifically about indoor air started in 1994 when I organized this event. I'm not sure whether you can see this. This is a book, Indoor Air, an Integrated Approach, some say 3 decades ahead of its time. So since then, we've investigated every aspect of indoor air and outdoor air as well. You cannot separate this. Every kind of source, every type of environment, every type of impact, anything which is necessary. We've published hundreds of papers on this topic in many different journals, magazines, and so on. But eventually, and this was before the pandemic, it started occurring to me, what is the point of doing this if the science is not used? And this was in many different situations in private and personal life, when it was so clear to me when I entered the room that no actions are taken about indoor air and that it's bad, not only visibly, but I did measure this with little sensors, different sensors at the time. What to do about this? In fact, we started before the pandemic. We stopped before the pandemic applying for research grants on this topic, not because we were not interested anymore, but because no one was interested, and grants were basically bound for failure. So this was the pandemic, and then we started looking at the different, not just from the angle of science, but from the angle of art. And this is a cover of a different book, Air. This was the exhibition organized at the Queensland Gallery of Modern Art, showing visually air. How can you show visually something which is invisible? Air is invisible. This was a big task for me when I was writing an essay for this book, how to present invisible in a visible way. If it's visible, it means that it's really polluted. So I was telling them, my listeners, my students at conference, I was saying, imagine, and just think, is there anything between you and me in this room? They would look surprised and they would say, no, there's nothing. I would say nothing. What about these quadrillions of molecules in every cube centimeter of the air? This is nothing. Then I was trying to visualize specifically pathogens in a different way. This was in the conversation article. I would say, imagine that the air I breathe out is pink, that cloud is pink, and imagine that it tumbles through the room, and imagine that it has in its green beads. These are pathogens. And imagine that this cloud is engulfing you. Imagine this. So this is another way of bringing basically awareness. Awareness was mentioned several times during this meeting. So it brought us to science, art, but ultimately it is not individual responsibility. It's not science we need. Ultimately, we must have a framework, a regulatory framework to ensure safe air. As I said, it's not our individual responsibility of science to say there's a problem in this air, to measure in this other environment. And it's not our individual responsibility to protect ourselves by wearing masks. Air should be such that we not need to wear a mask. So if air is not clean, it is a risk to all, to everybody in the room. But effectively, it excludes those with chronic health conditions who are more susceptible to infections if the air they inhale has airborne pathogens. And as it was said many times during this afternoon, millions of people who want to be part of the society, want to enjoy being together with others in indoor environment, but they cannot. So basically, as a scientist, I can say this is not a scientific debate anymore. Scientists are, usually set to always ask for more research, always ask for more money. I'm saying scientists don't need to do more research. We know what needs to be done, and we know how to do it. Indoor air is good. Indoor air is not a choice, it's not a privilege. Indoor air is necessity and our right. And this is what I'm saying as a scientist. So with this, I say that I'm extremely grateful for the Safe Air project to keep me a part and a supporter, and privileged for this. And I thank the project and its leader, Plum Stone, who are doing an extraordinary job of fostering understanding of the critical role of clean indoor air, clean air for the health of our communities, and working tirelessly to make clean air the norm. And I congratulating them to bringing us to clean indoor air for all Australians one step closer. Thank you very much.
Thank you so much, distinguished Professor Lydia Moravska, for joining us live, for talking about making the invisible visible, and also asserting that the science is settled. That is incredibly important. We have another panel now, and again, it's absolutely star-studded. We'll be bringing them up here in a moment, but I'll introduce them one by one first. This next panel will be moderated by a radiation oncologist. Many of you would know her. She's also the founder and CEO of Tobacco Free Portfolios, an NGO with a global footprint. She works with the Burnet Institute and University of Melbourne to help advance Australia's progress on indoor air quality, building on lessons from our world-leading approach to tobacco control. Would you please welcome Dr. Bronwyn King? Now, Bronwyn will be joined by a Professor of Economics, UNESCO Chair in Water Economics and Transboundary Water Governance, and an Australian Laureate Fellow. He's included among the top 20 economists in Australia and has worked extensively on the economic impact of COVID and long COVID. Please put your hands together for Professor Quentin Grafton. Also on the panel is the Head of Department and Professor with the Fluid Mechanics Group in the Department of Mechanical Engineering at the University of Melbourne. Since the start of the pandemic, he's turned his attention to indoor air flows, co-inventing a transmission prevention device for hospital patients and advising on better ventilation principles. Let's welcome Professor Jason Monti. And we're delighted to have the CEO of the Facility Management Association of Australia with us today. He holds multiple key positions on government and NGO committees that influence the built environment sectors and is a keen advocate for the implementation of indoor air quality rating schemes. It's Nicholas Burt. And alongside Nicholas will be the Assistant Secretary of the ACTU, a man who's passionate about the rights of all workers to have safe, healthy and decent work. A member of Safe Work Australia and the Asbestos and Silica Safety and Eradication Council, please welcome Liam O'Brien. Also joining us is the Project Director of the Pathway to Clean Indoor Air program at the Burnet Institute. Prior to this, she was an experienced executive in the Victorian Government, working across health and social policy, medical research and economic development. Please put your hands together for Christabel Ajoyan. And we also welcome back Associate Professor Robin Schofield. I'll move my Aranet out of the way and come on over, team.
Very good. Thank you, everybody. Thank you to Tracy. A huge thank you to Plum. It is wonderful to see this in hard copy. I read my version on a computer, but I just want to compliment you on the report, first of all, because it's filled with stories. And I think, as Lydia said, the science is settled. We know we need to act. But everyone knows there's not often a straight line between data and pure science and human behaviour change. There's some magic in between, and we need to work out better ways to make that magic happen. And I think one of the best ways is to hear real-life stories of what a difference change would make. And that's exactly what you've done in this excellent report. So great work, and thank you to everybody here and everybody at home who had the courage and grace to share those stories. So to start this panel off, because you're already warmed up, Robin, I thought that we might start with you. And I thought that it was obviously very touching for us to hear of your experiences as a patient. And in the past couple of months, so during your treatment time, data has been released in Australia showing that hospitals in Victoria, Queensland and New South Wales, if you just take 1 year alone, just take 2023, have had thousands of cases of COVID transmitted to patients while in hospital for something else. So they're called hospital-acquired infections. And tragically, of those hospital-acquired infections, 5 to 10% of them have resulted in the patient dying. Can you imagine that? Coming to hospital to have a knee operation or to have a heart procedure or to have some other important medical intervention, and in fact you acquire a disease that you didn't have before you went in, and that disease causes you to die? I mean, it's extraordinary. And so these are real people who this is happening to. And I know that, Robin, your concern about acquiring a hospital-acquired infection was very well grounded. You knew a lot. You're very health literate, science literate. What was it like for you to have to advocate for that as a patient who was exhausted and tired and immunocompromised? What was that like, and what is your message that you would like to give to hospital management all across Australia?
I think it's incredibly difficult to advocate for yourself. It's way easier for me to go here and say, you know, that's outrageous that that's happening to you, and you have that, create that distance. But to do it for yourself is very challenging, and it's easier just to go with the flow, right? But you know, I was confronted with some pretty tough decision making and around my treatment, and I just want to share some of those figures. They're in the report, but you know, surgery gave me a 75% of survival to 5 years. Radiation, about 11, I believe, and so chemotherapy is the tricky one, right? And if it's up around bumping between 3 or 6%, you go through chemotherapy. That's 3 months of your life that you can, you know, a roller coaster of steroids and then lows and immune compromised and everything. So, but you do chemotherapy to survive 5 years and for a 6% chance, right? Now, the statistics that Bronwyn just shared, you're not going to survive COVID if you get it at that time, like 5 to 10%. It doesn't seem like it's a problem to create this air to be safe in those environments, particularly when you've got these vulnerable patients. It's actually a waste of money to spend it on chemo if I'm going to be threatened by those other airborne threats for hospital-acquired infections.
Thank you. And I can't imagine how tough that was for you, and I really hope that we can make sure that we centre our patients around all the decisions we make in hospitals in a completely different way moving forwards. I'd like to move on to Professor Monti. Now, along with Professor Lydia Morovska, who we heard from just a moment ago, Professor Monti was one of the co-authors on a landmark paper that was published in Science in March of this year. And that paper included over 40 authors from all over the world, some of the cleverest minds in the world on this particular issue of indoor air quality. And they proposed 4 key metrics as baseline elements that we need to measure in the air moving forwards to ensure that our public spaces are safe. A lot of people around the world said, this is it, this is the consensus document we've been waiting for, and now we can get going. And I would just like to ask Professor Monti, is that a fair assessment? Is it a true consensus? Is it enough to get going, or are we still waiting for something?
Thanks, Bronwyn. Consensus, not my favourite word. It's the enemy of commitment, I think. But there are 41 authors on that paper. So it was very difficult to get agreement, and I credit the amazing leadership of Lydia Morovska just to get everybody to agree to publish it. For those of you who don't know, the standards in that paper, just very briefly, are to limit small particles, so PM 2.5 threshold of 15 micrograms per metre cubed over an hour, to limit dirty air from humans, our expulsions, so CO2 limit of 800 parts per million, limit harmful gas from cooking, so carbon monoxide, limits of 10 milligrams per metre cubed over 8 hours, and partly to achieve that, partly with ventilation rates of 14 litres per second per person. These are, as we've always said, are a starting point. They're a useful framework. We think these are 4 important things that need to be done, but they're not necessarily set in stone. This is a starting point for discussion. I think the consensus is from the experts that we can do better. Our ventilation systems have evolved to be primarily driven by cost and keeping people thermally temperature comfort. But there's a consensus that we can do better, that we can give a better quality of life. I haven't heard anybody say it's fine as it is. Nobody says that, right? So there's definitely a consensus, particularly from industry, right? Researchers will always advocate for better everything, but industry professionals are all the people who design, sell, maintain our ventilation systems, tell us that they're not being asked to provide better indoor air quality. So we don't provide the best, we provide the cheapest and the easiest. And if you want to give an analogy, we treat air a bit like as if in our water systems, our complex water delivery systems cost billions of dollars per year. 13% of electricity is spent on just on pumping water around the city, clean water. It's a bit like saying, well, we'll just run a pipe to the nearest creek or lake, and then we'll put a filter in your house or building, and there you go. You want water, you've got water. We know that will make people sick and make people die, right? People are sick and dying from indoor air as well. It's not just water. And we don't provide... we prefer that people recognise this and create a demand, but that's not happening, unfortunately, for our industries. So we need regulation and we need standards. And there's lots of ways to do that. You can do like some countries are doing. In Belgium, they enact new laws. In Ireland and France, they have codes of conduct to follow. In the US, we have ASHRAE's 241 pandemic guidelines for codes to improve building standards. And as we're here today to talk about, or part of what the Safer Air Project is advocating for a workplace health and safety route to improving standards. So I think there's consensus that we know the problem. There's consensus that we know what the solutions are, as Hayley was saying before. We have a proposed framework for standards. It's all there. As Lydia put it in this excellent document in her foreword, we lack the will to implement. And part of my work, working with Chris, who's going to talk in a minute, is not just about how willing to implement, but how do we educate and how do we demonstrate to businesses and to the public, how do we do this at scale in the real world and to benefit all Australians.
Thank you. Thank you so much. And it's a very nice segue in terms of, okay, we need the will. Maybe we need to work on that as a group of people. How can we encourage our leaders to take action? And Professor Grafton here might have some nice numbers for us, because if we have a look at his section of the book, so I'm on page 50, 51 here, you've got a whole lot of lovely stats for us. And I would like to ask you, I mean, there's a few that just jump out at me. In 2022, long COVID cost the Australian economy almost $10 billion. That's just one disease from one virus, or one long-term impact of one virus. And then here I was very interested in this, 2% reduction in labour supply in just 1 year from COVID, long COVID, 2%. Could you give us some of your favourite stats that we should be armed with as we walk these hallways in Parliament House?
Absolutely, Bronwyn, and thank you, Plum, and thank you everyone who organised this wonderful event. Look, numbers can get confusing and big numbers get even more confusing. So the $10 billion, which is $10,000 million, is about 0.5% of our total economy. And that was just for long COVID, just for 2022. If you start to add on the cost of COVID, so these are people who don't end up getting long COVID, but they are still sick, approximately a week for most people, or a week to 10 days, but of course a good proportion end up getting long COVID. Then you double that, so up to 20-odd billion, so that's 20 billion, 20,000 million. And then you start to say, well, the pandemic didn't end in 2022. It's still here. There are still people wearing masks. There are still people getting infected, as Bronwyn pointed out, in hospitals and medical facilities, health facilities. So it's still here. It's become less noticeable, but it's still here. So then you start to say, well, hang on. Let's add up 2022. Let's add up 2023. Let's add up 2024. And it'll go into 2025 as well. Now the mortality rates have certainly declined because of vaccination, and the number of people or proportions with long COVID may also have declined as more people have become vaccinated, etc. But nevertheless, we're still getting substantial, as in the multiples of billions of dollars of costs. So we did the analysis. We looked at the costs. They're very large. And then the way you look at that, those are the costs that we are incurring right now. Individuals, families, and the economy in terms of reduced labour productivity. And then you look at the other side of the coin. The other side of the coin is, well, what's the cost of doing something about this? That's about ventilation, it's about the filtration, it's about all of that indoor air quality, particularly in hospitals and healthcare facilities, but also schools and any public place. This place here has some of the best air quality of a public building in Australia, and that's not a coincidence, because the people who live here, work here, etc., they are the ones who made that possible, because they've made the investments to do so. We need to make those investments in other buildings and other parts of this country. That's absolute necessity. So we do those numbers of the costs, and we look at the costs of doing something, the costs of not doing something, and we get what's called a benefit-cost ratio. And it's uncertain because there's a number of assumptions that need to be made, but the minimum benefit-cost ratio that we get with our preliminary estimates is 1.5. So to put that into plain terms, it means if we spent $1, we'd get a 50% return. That's a very good return for an individual, but a very good return from the economy, very good return for the money that's expended out of the federal parliament. It could be much more than that. And indeed, numbers from New Zealand suggest it could be between 3 and 4.5 benefit-cost ratio. So those are 400% returns. So either way you slice or dice this, from a justice, basic human right issue, the issues around the economy, issues around public health, either way you dice this, it makes sense for us to act, and to act now. And so that's the message that the economics is telling us. Let's do something. It pays to do this. It makes sense from an economic perspective. It makes sense from a human right, from a public health perspective. So let's do it.
Fantastic. Thank you, Professor. Over to you, Nick. So I can't imagine what it's like to be in charge of the facility management of 200,000 different buildings across Australia. I mean, that is a mind-blowing number. These are buildings like shopping centres, airports, cultural venues, recreation venues, office towers. These are places that just make up our whole lives. They're public venues, there's public air everywhere. And so, Nick, what is the appetite for action on improving indoor air quality across that enormous range of buildings in your remit?
Yeah, thank you, Bronwyn, and thanks, Plum, for your efforts here and inviting me along. Managing Australia's built environment is really about making a building or a facility functional, fit for purpose, and doing that in the context of safe, healthy environment that promotes well-being for occupants. So the benefits that come from investing in this is that people do remain safe, they are happy in an environment, and they are pleased and appropriately willing to occupy a space. One of the issues that we have is that the quality of indoor environments is becoming more and more important consideration of both owners and operators of Australia's built environment. The focus on this continues to grow. People may have heard of the NABERS rating scheme, which is the National Australia Built Environment Rating System, and it's a government-owned suite of rating tools. And the biggest growth in the use of a rating tool that they have seen over the past number of years has been in the indoor environment space. So that's been growing at a greater rate than any of the other tools in the suite. However, that tool is limited to office space only at this point in time. This tool currently is utilised by private sector, and private sector are always interested in creating competitive advantage in what they do. The competitive advantage by providing a standard in the indoor air quality and a rating tool to measure that. Rating provides a mechanism for creating that competitive environment. This has occurred with energy efficiency over the last 2 decades, and all we've seen is people striving, when I say people, building owners and operators striving to become better and better at energy efficiency. And so by enabling that through the development of a clean indoor air standard or a safe indoor air standard and a subsequent tool to measure that and publicise it, we can create that same operating environment which will drive a race to the top, an aspiration, rather than just meeting a minimum standard. Since the pandemic, there's also been an accelerated and growing interest in indoor air quality to ensure the health, safety and wellbeing of all occupants. A number of owners and operators not only understand the importance of monitoring air, but already monitor that in their own environments. Overall, clean indoor air for people needs to be a choice about where they spend their time, and people need to have the confidence to be able to go into a space and know that it is not going to be detrimental to their health.
Fantastic. Thank you. Thank you so much for those comments. I'm now going to move on to Liam O'Brien. Liam, Australia has a very proud history of unions fighting for better working conditions for all Australians. I come from a tobacco control background, and I think, our unions were out there fighting for clean air so that there was no tobacco smoke to breathe in. We've also been very successful, the first country in the world to ban engineered stone so that people are no longer exposed to these very dangerous dust particles that are flicked off. How can we make indoor air quality more broadly applied as a principal safety element of our workplaces, and how can unions help us get there?
Well, firstly, thank you, Bronwyn. I'd also like to acknowledge country here in the lands of the Ngunnawal and Ngambri and pay my respects to elders past and present. I also want to acknowledge the work that Plum's done, not just in terms of putting today on and the great report that's been produced, but indeed for sharing her personal story and indeed to others, both in the room and those who contributed to report, for sharing their personal stories. Personal stories are so important in terms of not just advocacy in places like this, but in terms of talking to our friends, our family and our community, and indeed, in the context of a union official, talking to workers and workmates about why it's important that we keep our friends safe. It was said at the start around the right to a healthy and safe working environment, and it's a nice platitude, it's something that I say a lot, but for us as trade unionists it is an article of faith. But importantly, it's not just a right to a healthy and safe working environment, it is an equal right for all workers to a healthy and safe working environment. It is not just a right for the healthy few of us, and I say healthy in inverted commas. It is something that every worker in this country, indeed around the world, should enjoy, and I can say proudly it is one of the 5 fundamental rights and principles at work that the ILO recognise. And it's very clear that in this context, for trade unionists, it's really fundamentally important, because when we think about all the other rights that we fight for, this is the first and foremost important one. There is no more important right than a right to a healthy and safe work environment. I don't get to win secure work or decent wages if I can't come home from work as healthy as I went there. And so for trade unionists, the right to a healthy and safe work environment, indeed the right to clean air, is fundamental. You asked the question about, well, what do unions do? It's my favourite question, what do unions do? I'd really try and break it up into 2 things, 2 categories of work that trade unionists really devote themselves to. The first is the practical stuff in workplaces, representing workers, colleagues and so on, in actually making work safe. And we fundamentally have a rights-based framework when it comes to work health and safety that enables workers, their representatives, to take action in workplaces to force, and I say force because with no disrespect to employers don't make workplaces safe because they're benevolent. They make workplaces safe because they are forced to do so, because there are costs involved in making workplaces safe. But the second part, and I think this is really where Bronwyn wanted me to go, is in terms of advocating for better rights, for better standards. And I think this is where, when it comes to clean air, we are really in the midst of a big paradigm shift in this country. Notwithstanding, we have a horrible history and legacy when it comes to poor air and its impact on workers. As was said at the opening, I'm a member of the Asbestos and Silica Safety and Eradication Council. I just left the meeting there and will head back there after that. People don't realise that the biggest killer of workers is not falls from building sites, it is asbestos. Asbestos kills 4,000 people every year. We banned it 20 years ago and it continues to rise despite that. So I think we are in the midst of a real paradigm shift when it comes to air quality because, as we said earlier, bushfire smoke, COVID and indeed silicosis, which was really acute amongst stonemasons working with engineered stone, but actually affects 600,000 workers in this country. And I acknowledge the many people in this room and indeed a few online that really put their shoulder to the wheel to start to close that gap. And for me, that gives me a great deal of hope. I touched on asbestos. We knew asbestos was dangerous in the early part of the last century. It took us 80 years to ban it. We found out about engineered stone in 2014, and in 2023, 2024, we've banned it. So I think there is a great framework we've got in work health and safety that enables us to combine what is a general duty on employers to keep workers safe, as well as prescriptive standards that show them the pathway to it. A big part of that disconnect is about building a state of knowledge. It's great that we've got science now that settles a consensus about what is safe or safer air. What really is now incumbent, not just upon the trade union movement, but indeed upon the whole community, is to now convince governments, and indeed I say convince employers, that we need to set those prescriptive standards. Actually, it's in everybody's interest. To the comments made before, good business should want strong standards because it ensures that the good practices that they do are not undercut by poor actors in the system. And so standards are really important for us, and that's why our movement is committed to ensuring that we have good clean air standards. We think the framework can be adapted quite easily to address it. And so I'm very hopeful of the opportunities that are before us in terms of how we can progress things, Bronwyn.
Fantastic. Hope and optimism, they're always words that I like. It's such a pleasure to now introduce Christabel, who is my colleague now at Burnett Institute in Melbourne. And look, many of you may have heard that Burnett Institute is leading a couple of very interesting clean indoor air projects that have just kicked off in Victoria. And we're very happy that Christabel is here to shed some light on those and tell us how they're going, what's happening and what the goals are.
Yeah, absolutely. Thanks so much, Bronwyn. It's an absolute pleasure to be here today. And I've got to say at the outset that I think Victoria is doing some excellent work in this space. I think we're really leading the way in the nation to really kind of push forward a platform that I think can be adopted nationwide. So I do want to acknowledge the incredible work actually of quite a number of people in this room who have been instrumental really to pulling together some proposals that government have accepted and have really taken forward and have funded. So Jason obviously and Robin here and Lydia on the call, obviously Bronwyn as well, have been really key to and part of the collaboration with the Burnett Institute on this work. So I think we've got the trifecta in Victoria, and I think that's why things are working quite well. We've obviously got an incredible medical research institute through the Burnett and some excellent researchers there, but we've also got the experts and the engineers at the helm, and we've got a growing industry in the state as well. So I think the trifecta of that has really been a great motivator for government to really invest. And so there are two key projects that we've managed to seek to achieve investment from. And so the first one is the Pathway to Clean Indoor Air program. And that project has only really just been announced and we're really kicking it off at the moment, but that is really essentially about piloting some evidence-based solutions across a number of settings in Victorian workplaces, in potentially some schools. We're going to be looking at other healthcare settings where we're really looking to pilot some real-time air monitoring and combine that with some tailored interventions across those sites, and then really pulling together the scientific rigour to pull together an investment piece that then we can put to government that they can take and replicate and scale across a whole range of industries, right? So not just really bespoke spaces. We know healthcare does indoor air quality relatively well, but there's so much more that we can be doing in schools, in early childhood settings, in workplaces across the country that really will make a fundamental difference to the safety that people experience when they walk into a room. So the other project really is the Elucidar project. And that project is a clinical trial that is also running in Victoria, and that is an upper room germicidal ultraviolet light clinical trial. It's being rolled out in 60 Victorian aged care facilities, and so we know that GUV plays a significant role in TB and managing TB and reducing the transmission of airborne disease in that space. But we are using this project to explore the efficacy around COVID-19, reducing airborne diseases related to COVID and other airborne respiratory diseases, obviously RSV, flu, very significant issues that can dramatically impact the health and wellbeing of people in aged care settings. So that is a randomised control trial. It's taking place at the moment. the work, obviously, Jason's obviously involved in that one as well. So we're kind of working through that with the Victorian Department of Health, and we're really excited to see what outcome of what that will show, and how that can be then applied to settings outside of aged care.
Fantastic. Well, good luck. Get going, and we're all very eagerly awaiting to hear, first steps, preliminary results, anything you've got. So thank you so much. Now, we've only got 5 minutes, so I'm just going to go straight across the top to ask for some closing comments, if I may. So, Nick, I'm going to start with you at the end and just say, do you think we're going to see a day where we'll either be able to charge premiums for people who are leasing buildings, or charge premiums for those who are investing in buildings, because they're going to be considered more pandemic-proof or more climate-proof than they've ever been before?
Or more productive, or just safer and better for people's well-being. I absolutely see that there will be a day when that happens. It happened with environmental and energy efficiency, and it didn't take that long. And we have a very collaborative but competitive built environment in Australia. And so if we give them a measuring tool, they're going to want to measure each other and play towards being the top performers. So absolutely. And we'll continue from the FMA's perspective to support efforts to make that happen.
Fantastic. That sounds very exciting, and I know there's lots of people in the room who are working to see that happen as well. Jason, over to you. You mentioned a lot of international work. I note on that paper that you and Lydia wrote that there were people from all over the world. Can you just give us an insight onto the strength of those global collaborations and how Australia can benefit by being part of those?
Yeah, absolutely. I think there's, as Nick was just saying, there's a lot happening. There is slowly change starting to happen, but it tends to, once it starts, it tends to steamroll. And that's happening around the world. It's not just us. I think the document shows all these great things that are happening around the world. A lot of it is actually led by standards, regulation, codes of conduct, etc. And we're all learning from each other. And it's a great time to be in this space, because so much is happening so quickly. But as has been said, part of what we need to do is get on and do it. And that, I think, we can lead the way, because Australia is, as you said, quite a dynamic place in terms of the built environment. We're a privileged country that we could probably we could probably afford to spend a bit more than others, and therefore we can lead the way in demonstrating to the world how you can actually do this. And I certainly see the day that this is going to be, I mean, there's no question, we're definitely going to be living in a cleaner air environment in the future.
Thank you. And Robin, just coming back to this report and what it means to you, you're in it, you're featured in it, you've generously shared your story. What's a practical thing that you would like to see in 2025? Just a practical step forwards that would benefit the community, especially patients and those seeking care in our healthcare system.
I would like to walk into a hospital and not be faced by clean your hands, but actually an acknowledgement that the air is something that we need to think about. And
it does deserve it, mate. I think that would be fantastic. And in a way, I mean, if we go back many decades, doctors and nurses and healthcare professionals didn't wash their hands because they didn't understand, because they couldn't see the bugs. And in the same way, we can't see the bugs in the air, so we're still struggling with this next step of infection control. So I fully support that and would love to see that come very quickly. Liam, you mentioned some time gaps. So if we go back to tobacco, we knew tobacco was a deadly product in 1954, and here we are still struggling with it, 10, 20, 30, 40, 50 decades later. But we have made much progress over that time. Silicosis, you mentioned that engineered stone issue was around for about 10 years before we took action. How can we shorten this particular time gap for this issue?
Well, I mean, I don't think good policy just gets us to the line. The story with each of those, very strong commercial interests that fought back in some of those cases, very hard, needs to be countered with equal amounts of public support, in particular activism around this. Our movement knows only too well that the only way in which you make progress is that you build strong support and you create pressure on those decision makers. I think the fortunate thing, as I said before, is that we have a very good, well-worn path when it comes to making workplaces safe. There is a clear road that we can push down along, but it is very much dependent on our ability to persuade governments, not just the federal government, but indeed every jurisdiction. We need 2/3 of states and territories to agree to amend our work health and safety laws. So, it's not just the people in this building. In fact, the people in this building probably have the least agency when it comes to work health and safety, which is regulated at a state level largely. It is state members of parliament, state ministers for work health and safety that need to be convinced that this is a significant risk, that there is an established practice in terms of how we can better control it, and that the framework can be adjusted very easily to do that.
Fantastic. Okay, we've got our work cut out for us, everybody. On to the states. Quentin, in the booklet you call on the Productivity Commission or the government to instruct the Productivity Commission to do a more comprehensive study. Could you just give us a moment about that and tell us about that?
So I highlighted, thank you, Brian, highlighted that there's uncertainties around a number of aspects of our numbers, as there would be for anybody doing this. So a productivity inquiry would actually get that number, those set of numbers out there, several months of full-time people working on it, qualified people, and then presenting that in the context to the federal parliament, and then having hopefully a snowball effect in the context of, well, actually, if those numbers are what I think they are, and what we've estimated, high levels of benefit-cost ratios to doing something, then it starts to bring that snowball effect. But again, I just want to highlight, and everyone knows this better than I do here who work in the space, it's about people pushing forward our leaders, our decision makers at a state and federal level. And we have 3 MPs in the room this morning. I take my hat off to them. It's over there for engaging in this space. But we know that there are leaders in this building right here who are ignoring these issues, and there are minimisers throughout this country, not just in the federal parliament. And we have to push back against them as well. It's not just the case of everyone's on board. We have to push back to the people who've been minimising since 2020, and we need to say, this are the facts, these are the numbers, let's act. And if you chose not to act, then we need to know who you are and why you choose not to act. Thank you.
Thank you, Quentin. And last words for you, Christabel. Look, as a parent myself and with some very hard-working parent advocates in the room, it is music to my ears that you are going to focus on schools, because I really feel that schools have been a little bit overlooked, and it's very much featured in here. We need to make sure that our children have access to clean indoor air environments. So that is bringing me great hope. What's bringing you hope for 2025?
Well, I think being here today really is bringing me a great deal of hope. I think, we've had 4 years of this, and I think this is the first time we have been in a room together being able to talk about this in this way. I think the work that you've done, Plum, with this report has been incredible, and I think that the fact that we've had some support from government members is the path forward. So I think for me, I see that as hope. And I think that we continue to leverage that. We continue to take the research that we know already exists. We take the models that we're looking to deliver, apply them, and push government as hard as we can to get some change.
Fantastic. A round of applause for our esteemed panel. Thank you so much to our brilliant panel of experts and magnificently moderated Dr. Bronwyn King. Look, I highly recommend that you all take a read of this extraordinary report. It really is outstanding and covers all the areas that we've spoken about. But the key message that jumps out to me after this session and this launch is that clean indoor air is an access and inclusion issue, and frankly, it is a human right. Thank you all so much for coming, particularly those who had very few spoonfuls of energy, those in the room and all of you online, and for your advocacy and powerful collaborative work. But to wrap up, we're going to hear from the founder of the Safer Air Project, Plum Stone.
Thank you, Tracy. And thank you so much to all the panellists and all our speakers today. I am so grateful to you all for answering the call. I got super excited when we were told we could have this event, and I invited everybody because it was just too exciting. So thank you, and thank you everybody who's here in the room. And to everybody who's online, we had more than 300 registrations for online, and I know that a lot of people, I can see Tyler Smith in the corner, you're dialing in from Tennessee, so it's very late where you are. I'd really particularly like to thank our panellists from our lived experience panel. It is really hard living in a world where it is unsafe to breathe, and it's really difficult to navigate that journey with young children. I've got young children too, and it's really hard. I'm really grateful to you. It is hard to tell your story too, and I'm really grateful to you for sharing those experiences. I want to give one shout out to our patient organisations who are here today. Thank you all for coming, and for coming to listen, and for wanting to be part of the journey to make your communities safe. So many of us living in high-risk communities, you know, we're looking for this change. So thank you all for being here. I really appreciate it. Before we wrap up, I'd particularly like to thank Safe Air Project's partners and sponsors. Founding a charity is a deeply humbling experience. It's a leap of faith, knowing that you can make a difference, but it also comes without a safety net. So thank you to our sponsors, in particular the Cainro Foundation, the Bellevue Foundation and Plasma Shield, and all our other sponsors for believing in our vision and supporting us to achieve it. We couldn't do this without you. We literally wouldn't be here in this room today, so thank you very much. It means a lot. And finally, there's been a lot of thanks to me today, but I also want to thank Amy, because I wouldn't be here without Amy, and this report would be a Word document in Times New Roman, and it would be awful. So thank you to Amy, who has the most incredible design skills, and just for being an all-round great friend. It's incredible to be on this journey with you. So thank you very much. And so that's it. Thank you very much. Thanks for being part of our journey, and for joining us as we seek to create a world where everyone can breathe safely indoors. Thank you.
Do you want a team photo? Yes.